So I'm excited to welcome to the room, Rural Doc Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic is miscarriage. What is a miscarriage?
Well, strictly speaking, it's a spontaneous loss of pregnancy before 30 weeks. Some people divide them into early, which would be up to 12 weeks, and then late, which would be 13 to 20 weeks.
Is miscarriage my fault?
Well, no, never. It should never be considered your fault. It's got nothing to do with something you did do or didn't do or should have done and didn't do. But it is often associated with guilt because it's very common to feel that it is your fault. Remember, it's not your fault.
How common is a pregnancy miscarriage?
Well, we used to think it was about 25% of all pregnancies. Now that we have more sensitive pregnancy detectors, we now think it's probably 30 to 40% of pregnancies which miscarry or are lost before term birth.
What is the most common week to miscarry?
Well, certainly before 13 weeks, but I would say most commonly it is 7 or 8 weeks.
What is the most common cause of early miscarriage?
Well, it's when the fetus is not developing normally. There's something that is incompatible with life, a disastrous chromosome anomaly, and sometimes babies are born even without brains. So all of those are not compatible with life.
What are the common symptoms of miscarriage?
Well, blood loss, fluid loss, early pieces of the placenta. Sometimes you can see a fetus. You've got rhythmic pain. It's similar to a heavy period. Bleeding can last up to 3 weeks. But of course, anytime you think you need to call your doctor, go to the emergency room, do that.
How long does it take to physically recover from a miscarriage?
Well, that depends, but I would say for the most part, you're looking at 4 to 6 weeks. That's when you should have a normal period again. And during that time, you should avoid putting things in your vagina, tampons, or intercourse for 1 or 2 weeks anyway.
Do you need to see a doctor?
Well, I would say anytime you think you need to see a doctor, you should see a doctor. And of course, if you're Rh negative, you'll need to get RhoGAM and you'll need to go to a doctor to get RhoGAM.
What are some complications of a miscarriage?
Well, you can have an incomplete miscarriage, and that can lead to an infection or can lead to bleeding for a long time. And again, you can be Rh negative and you don't want to miss your opportunity to get RhoGAM.
All right, the best place to go is ruraldocalan.com and pick up Pregnancy Away. Today, available on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the Rural Doc Alan podcast casting.